diabetic retinopathy and the causes of diabetic retinopathy as well as symptoms I've explained you earlier. So now I will be telling you about the stages of diabetic retinopathy. So primarily in diabetic retinopathy there are usually 4 to 5 stages, and I will be explaining you the stages of diabetic retinopathy. In stage 1 we call it as non-proliferative diabetic retinopathy mild stage. So it is usually called as mild non-proliferative diabetic retinopathy. In this stage, what happens is, it is an early stage where the patient is detected with diabetes in an early age, and the effect of diabetes is not that evident. So what happens is, if a patient is been diagnosed recently or his sugar levels are not that high compared to other patients, the damage to the retina is very mild or minimal, and it can be reversed. In certain cases, it can be reversed. So what do we do in stage 1? Mild non-proliferative diabetic retinopathy. We try to control the sugar levels and bring them to the normal stage. It is usually seen in younger population where they have initial onset of diabetes and they are unaware of it, or sometimes due to lifestyle changes and the diet modifications that they need to be done, the sugar levels can be controlled and the stage can be stopped there itself, and the damage done to the retina can be halted here, and due to medications and other holistic approaches, this stage can be stopped. Okay. Following the first stage, the second stage is moderate non-proliferative diabetic retinopathy. In second stage of non-proliferative diabetic retinopathy, where it is a moderate stage, here too there are not many symptoms that can be seen in the eye. So there might be slight blurring of vision, or there might be certain darkening seen in the field of vision, but it will not be adequate and it will not be evident as the later stages of diabetic retinopathy. So what can be done to prevent the progression of the disease? So the maintenance of sugar levels to the normal range through taking of oral tablets as well as insulin levels, and maintenance of the sugar levels below the normal range, and HbA1c levels in the range of 5 to 6 will be adequate to reduce the progression of the disease to the further stages. Coming to the third stage of diabetic retinopathy. So the severe form of non-proliferative diabetic retinopathy is usually the third stage of diabetic retinopathy, where the patient experiences even more symptoms such as blurring of vision, dark spots, floaters, and these kind of symptoms. But this is usually seen where the diabetes is uncontrolled for usually a prolonged period of time, and the patient is usually unaware of it, or is aware of the disease but is not taking the adequate medications required. Sometimes the patient usually takes the medication, but he goes for alternative treatment methods where the sugar might not be controlled. These also cause the progression of the diabetic retinopathy. So adequate maintaining of the sugar levels in the blood is utmost importance to prevent the proliferation of the stages of diabetic retinopathy. Coming to the fourth stage, here it is called the proliferative diabetic retinopathy, where the blood vessels supplying the retina is already damaged and we can't do much about it. The reversal process is usually a surgical intervention, and depending on the symptoms on the damage done to the blood vessels and the retina, the treatment usually is done. But the symptoms will appear and it will be more than that of the previous 3 stages. So you might experience dark spots in the field of vision. So if you are looking somewhere, you can see small dark spots that may appear in the field of vision. As well as the blurring of vision is usually seen. Some people may say that it might be due to the power. I have developed some myopia or hypermetropia, but usually it is due to diabetic conditions. And wearing glasses or wearing any other wearable devices as a lens will not change such conditions unless you control the diabetic part of it. So these are the 4 stages. These can be controlled, and the progression of stage to stage of the diabetic retinopathy can be managed, but you need to take care of the blood sugar levels. So controlling the blood sugar levels, so avoiding the treatment part, and also stoppage of the treatment, preventing the control of the blood sugar levels will cause the progression of the disease. So preventing this progression is utmost important. So even if you are diagnosed with stage 1 or stage 2, mild, moderate or severe. So depending on the stage 1, 2 or 3, mild, moderate or severe non-proliferative diabetic retinopathy, it can be stopped and the progression can be slowed down. It all depends on the patient as well as his or her willpower to control the blood sugar levels. So you need to check your blood sugar levels regularly and continue on the medication part, have a holistic approach as well as a diet as well as exercise part. So you also have a holistic approach to maintenance of diabetes. So just medications from a doctor's perspective will not be sufficient. You need to have a nutritional as well as a general lifestyle modification that you need to do. For example, you need to have food that is very low on glycemic index, as well as you need to have food in a regular basis and not in an excessive amount. So what happens is the blood sugar levels are normalized and they are stable over the period of the day. As well as you need to take medications if required and continue the medications so that the blood sugar levels do not go beyond a certain range and cause the retinal damage that are usually seen in diabetic retinopathy. This in turn will reduce the progression of the disease from stage to stage and help the patient recover better. So what is diabetic retinopathy and also the causes as well as the treatment I have been explaining to you. Now we will get to the part where there are complications that develop in case the diabetic retinopathy becomes uncontrolled and you are not aware of the causes as well as you are not aware of the treatment of the condition. So we go to a condition where there is a diabetic macular edema. This is a condition where the blood vessels get blocked and the content of the blood vessels start leaking around the retina. This causes the edema of the macule and this also causes blurring of vision. These are primarily the signs that are seen during the 4th stage of the diabetic retinopathy. These can be easily prevented by the steps that I have been mentioned to you earlier as well. There is another condition where the complications may lead to vitreous hemorrhage. A vitreous hemorrhage is where the blood vessels get ruptured due to the blockage and the hemorrhage is formed in the vitreous humor. This causes the blinding as well as the visual disturbances in the visual field. This also can be prevented from the steps that I have been mentioned to you earlier. In complicated cases, the retina gets detached because of the ligaments that hold the retina in place get destroyed because of the decreased blood supply by the retinal vessels. When the retina gets detached, there is a high probability of blindness and loss of vision. So we need to prevent this by the steps that have been mentioned to you earlier. Diabetic retinopathy also causes a condition called glaucoma. Glaucoma is a condition where the intraocular pressure is increased, is elevated because of the leaking of fluids from the retinal vessels. Retinal vessels get damaged because of the uncontrolled sugar and other causative factors such as hypertension, dyslipidemia, and cause the leakage of fluids that are present in the blood vessels. Fluid leakage from this causes intraocular pressure increase and the glaucoma is seen. Untreated glaucoma may also lead to blindness and other complications in the person. So you need to prevent this by the use of other methods such as control of diabetes mellitus, hypertension and cholesterol in the body as well as cessation of smoking. So these have been mentioned earlier in the video as well. If you can have a look at it, it will be better.